From the JAMA Network, this is JAMA Clinical Reviews. Interviews and ideas about innovations in medicine, science, and clinical practice. Here's your host.
Hello, and welcome to our listeners around the world. Thank you for tuning in to this JAMA Clinical Reviews podcast. I'm your host today, Dr. Joseph Ross, a deputy editor of JAMA and a professor of medicine and public health at Yale University. I am here today with Professor Michal Mankowski, an assistant professor in the Department of Surgery at the NYU Grossman School of Medicine, along with Dr. Jane Long, a surgical resident at NYU Langone Health. Jane and Michal led the article we will be discussing this week, which characterized national trends in patient portal messaging over the period from 2020 through 2025, examining how patient portal messages fit within the larger context of visits and communications between patients and clinical teams. Thank you both for joining us today.
Thank you for having us.
Thank you so much, Joe. It's exciting to be here.
Michal, let's start big picture for our listeners who may not be clinicians. Can you explain a little bit about patient portal messaging, how it works, how it's paid for, and why you both were interested in studying these trends?
So that's kind of a new topic. I think became more of the topic during the pandemic, after the pandemic. For sure, it's of interest to patients, but also the clinical community. So basically, it's a secure way to communicate between patient and provider through electronic portal, or can be done through the web browser, can be done through the mobile app. I think the big difference is that this is a way of communicating with your care team, which is asynchronous. So you don't have to be in the same room. You don't have to be at the phone line. It's basically happening not at the same time, which is, again, quite different than a real-time phone call or a telehealth visit where you and your clinical team or clinician has to sit on a laptop or on the phone and talk to you at the same time. Messaging can happen at any time. The same like you message your friend or your care partner or a partner. Often topics cover a patient message about all different things. It's often about follow-up of the visit, medication refills, asking about test results. And those messages can be answered by physicians, but also by nurses, by advanced practice clinicians, and medical assistants. And talking about billing, I think that's very complicated, and I think that really deserves like another JAMA, probably full investigation. But yes, CMS allows to bill for patient portal messages, I believe from 2020. But we did not look at the billing itself. A number of studies have shown that indeed some messages are billed. It's a small portion of the messages. And centers for health systems that really bill are kind of also concentrated. So definitely it's a topic for the future. I think the feeling of clinicians, and I'll ask you guys, because I'm not seeing patients, but you do see the patients, I think it often feels like as uncompensated effort. And that's why we're also interested to look at this phenomena. Because as we've shown, definitely the messaging is increasing for like last 5-6 years. And also I have a personal angle. So my partner is a family medicine doctor, and I could definitely see her kind of pajama time spent on answering those messages and bringing more cognitive burden and just kind of workload to home. So there is professional interest, there's personal interest, and yes, we are very excited about the study.
Yes, pajama time. We've all been there. We have to finish our notes, finish the work that we have to do within the system. Jane, you're a surgical resident. You're the busiest of all of us, and you're right at the front line of care. What's your experience with patient portal messages, and what got you interested to work and lead this study? To me, they often seem a little bit like a double-edged sword. Perhaps the messaging works in some circumstances. It offers the convenience, of course, and asynchronous communication often is fine. But other times, I've been there, you get a message and you're like, you should have picked up the phone and called. You should have come into the clinic. This is more worrisome.
Yes, for sure. That matches my experience pretty well. It does feel like a double-edged sword. So it's super convenient and it's really flexible. And I'm sure patients love that as well. It's really good, at least in residency, to be able to respond on our own time during a busy day. So it's really helpful for things that aren't so urgent, like maybe a medication refill or clarifying some instructions or requesting some forms. And it's also really helpful because over a telephone call, you can't really see what patients are talking about. So it's nice that patients can send photos of things that they're worried about or maybe a surgical site. But it's tricky because a lot of the messages go beyond just like a simple exchange. And even the simplest messages are kind of deceptive. So like a straightforward question oftentimes still requires careful chart review. So we'll still have to look at the notes, we'll still have to look at the operative report, check your medication, how things went. And then oftentimes we still have to confirm the plan with an attending, and we have to loop in the rest of the team and then write that thoughtful response. So even though it looks like a short response to the patient, there can be some more substantial work behind that.
If you had to guess, in the course of your typical day, how much time do you think you spend responding, dealing with, not just responding, but, dealing with patient portal messages?
I feel like that's really hard to quantify. And because it varies so much by your service and the culture of that service and team. But I guess like the way of answering but not really answering is that like messages can come at any time and we can check it at any time. So we don't have like dedicated clinic time blocked off. So it does feel like it can add up. Typically on service, you might feel like you answer a couple of messages a day, and that might be, 5 or 10 minutes here and there. But it can feel like a meaningful amount of time, even though it's like 5 or 10 minutes and your attention switching between tasks. It can feel like more than it seems, I guess.
Yeah. Well, Michael, let's come back to the study. Maybe for our listeners, you can talk a little bit about exactly what you guys did, what you found. It appears when I read the study that patient portal messaging has grown dramatically, while telehealth visits, like as an absolute number, barely register on the graphs. And I think that would surprise a lot of people. I think people think telehealth visits are going up, but not so much.
So we kind of started from looking at the patient-provider messages, but we end up kind of comparing this way of kind of encounter communication with recurring team across other types of encounters, which could be also office visit, can be phone call, or as we said, telehealth. So we leverage this kind of new data set, which is called Cosmos, coming from Epic. And Epic is the like IT EMR provider for a lot of health systems. It's a secure database providing over 300 million individuals from over 350 healthcare systems, over 2,000 hospitals, almost 50,000 clinics. So it's really full-scale national database, de-identified, linked together. That's why this study is exciting, because we are providing numbers in billions, which is also kind of very rare in healthcare, unless it's dollars. If you don't talk about dollars, it's hard to provide an evidence from 1.3 billion of messages offered by patients or a few billion of office visits. So this study is really unique to provide this kind of high-level but very, very rich overview of the national trends. And yes, so what we found, basically looking from Q1 2020 through 2025, that indeed patient portal messages, but the ones that were sent by patient, increased by 150%, from about 1 per year to 2.5 per year across all the active patients. And this database covers all kinds of hospitals, from academic hospitals to like community safety net hospitals. So we can have like this nice national coverage. And I think the most important question here that we try to answer is whether the patient message is the new modality, it's an extra modality, or it's trying to replace the office visits. So do you send your message to your provider instead of going in person to the office visit? And of course, our study is only descriptive, but seems like this is a new modality and messages do not replace office visits. And I think that's a very important message for healthcare systems, for administrators, how to handle this burden, which basically it's not a substitute. A message is not a substitute. It's really a new way of communicating. And I think another message here is that like the healthcare is becoming more continuous in a way. It's not a discrete kind of event from visit to visit, but like now you can communicate with your care team almost every day. So that's also kind of a bit paradigm shifting.
The Cosmos data resource is really spectacular, but is there any reason you would think that the findings would be different if you were looking at data from a different EHR vendor or anything like that?
Epic has like a pretty large penetration right now in the market, I think, especially nowadays. But of course, other vendors might have a bit different workflows, how basically the messages are handled. But I still believe that overall, if a person wants to send a message, they can send a message and this message will be responded. So while, of course, we are kind of looking at the one vendor only, I believe this having the large N, and again, we look at the over 50 million people who send a message. Yes, I think we can be pretty certain those trends more or less generalized.
Yeah. I mean, one of the reasons we wanted to highlight this work that you guys have done so well is, to me, it really illustrates just how communication between clinicians and patients is just transforming. I wonder if you guys could each reflect a little bit about what does that actually mean in the context of healthcare delivery today? How it's going to change further in the long-term future? Will it continue just to grow? Will it stop as people start using their ChatGPT LLMs to ask questions instead of their physicians? And I guess the hard question, of course, is this kind of messaging playing the right role in terms of improving access to care while maintaining quality or reducing costs, or is it just adding more and potentially confusing things? So hard questions, but this is the crux of the matter here.
Yes, so I think the message are going to stay here. So we can see those trends are going up, and I don't think they're all going to suddenly decrease. So that's for sure a big message. And talking about AI, so I think there is AI on both sides. So if patients are asking ChatGPT about the medical advice, but also health systems are trying to leverage AI to draft the message, to triage the message. And we see uptake of this kind of AI drafting and triage over last year. I think that's another follow-up paper would be to look at the burnout, but also like satisfaction of both sides, of patient and provider, using those AI tools. So I think it's the future. Jane?
I think I agree. I think messaging seems like it's not going anywhere. I think probably a lot of patients and families and their caregivers have gotten used to it. So they'll probably want to be able to continue to send questions and photos without having to come in or call sometimes. And I think from our perspective, it's also pretty helpful. But I think it's kind of to what I spoke to before. Messaging is not straightforward. Oftentimes, messaging is like the first contact point, and then oftentimes we still have to call a patient for follow-up questions. We still need to talk to everybody on the team. So it improves access in some ways, but it does create more clinical work. I think another point that comes up in our discussions a lot with Michael and the team is from this paper, we have to be careful not to assume that messaging automatically means that everybody has better access to their providers. So for some, it really is a good way to stay connected and have that continuity of care between visits. But we have to recognize that the people that we're not capturing, or maybe what you were alluding to for those who aren't in this like Epic system, and this may be older patients or patients who are less comfortable with or have less access to technology, that a phone call or a visit may still be a better way to communicate. So I think it depends on how thoughtfully we implement and interpret our results. So I guess specifically for this study and people who are maybe in the Epic system that we're talking about specifically, it's a good way to improve access and continuity of care because, you can work around schedules and needs, but only if that workflow is built around it to support patients and also the clinicians and care teams that are involved.
Very important things to remember. But it does sound like you're not ready to delegate your responses to Claude.
Probably not. I mean, even when I ask around, it's often not the response. It's the verification. If I don't know, AI were to write a response, it seems like when I ask co-residents and things, I think there would still be a lot of verification needed. The only nice part would just be lowering that activation energy to start the note.
Exactly. So Joe and Jane, correct me if I'm wrong, but I think it's really it's not about the drafting itself, but kind of this cognitive load of verifying the data, checking the patient's chart, making sure you prescribe right medication. And I think this is where really the load itself it lies, not really on the message itself. Also early on in NYU, we've tested the message drafted by AI, and we've got a feedback that not everyone loved them. It's not about just, the trust, but the style, it doesn't sound like me. It's it's not me, and I don't want to communicate that to my patient. So I think there's still a lot of work to do that.
Is there anything else you want our listeners to know about this work and what you guys have done, or the next steps that you're going to take?
I think that it's important to note that the role of the proxy, so proxy is someone who can message or act on your behalf. So let's say care partner of an older person or adolescents. So I feel this is kind of underutilized venue, or at least here at NYU, we're also trying to encourage this kind of care and that can really impact someone's well-being and patient's well-being and access to care when you can basically have your doctor or someone else checking your meds on your behalf or asking for a medication refill. So I think that's an easy gain that can be done and also should be studied about disparities in access.
Yeah, no, I'm really glad you brought that up, because even if it doesn't necessarily, quote unquote, improve access or quality or whatnot, it allows everyone to be on the same page, which you would hope would have expected benefits for the patients and reduces the uncertainty for the family as they're helping to take care of that person. So. All right. Well, Michael, Jane, thank you so much for joining this JAMA Clinical Reviews podcast. Again, I'm Dr. Joseph Ross, a deputy editor of JAMA, and I've been speaking today with Professor Michal Mankowski and Dr. Jane Long about their recently published article, Characterizing National Trends in Patient Portal Messaging. You can find a link to this article in the episode description and show notes. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.